Welcome back. So recently, I read a report that stated mild iron deficiency anemia was a normal part of pregnancy. This really caught me off guard because anemia is a diseased state of the body. At a time when we want a woman's body to be functioning and performing at its ideal state, such as in pregnancy, we are saying a disease state is in fact normal. So it is paramount to recognize that just because something is common does not mean it is normal, and surely does not mean it's optimal. The statistics on iron reserves in women of childbearing capacity are a bit concerning. 20% of women have iron reserves of greater than 500 milligrams, which is considered the minimum required during pregnancy. 40% of women have iron stores between 100 and 500 milligrams, and another 40% have virtually zero iron reserves laid up for the potential pregnancy that may be coming down the road. So it's no wonder that it's considered normal for a pregnant woman to suffer from iron deficiency anemia. And as the pregnancy progresses from first trimester to third trimester, the need for absorbed iron, it'll increase like 7 times. According to an article published in the Journal of Internal Medicine, a woman having pre-pregnancy serum ferritin greater than 80 micrograms per liter or greater than 70 micrograms per liter in the first trimester of pregnancy, that group of women would be unlikely to need iron supplementation. So really, if you want to maximize your chance of not having to take a bunch of iron during your pregnancy, or ended up on iron infusions, that kind of thing, then aim to have your ferritin levels above 80 micrograms per liter before you ever get pregnant. Ideally, every woman who's planning to get pregnant would get a serum ferritin along with copper, seroplasmin, iron saturation, iron, CBC, and a total iron binding capacity level before pregnancy even came about. And then do that again during the first trimester and at the beginning of the third trimester. And I often see pregnant women holding, reasonably well. They're just kind of on that border, kind of iron deficient, kind of not during that first trimester. But then between weeks 28 and 34, their ferritins just boom, drop intensely, significantly. And this does not need to happen if we've seen where our levels were at the beginning and we've made sure that they're not slowly trending down. If we're ensuring optimal iron intake and levels before pregnancy and then the first and second trimester, most women should have sufficient iron reserves to make up for the large blood volume expansion that's going to happen in the third trimester. So the need's going to rise in the third trimester, and if we're already ahead of the game, women should be able to be just fine and maintain throughout. And this is not just for the mom, this is for the baby as well. As babies born to ferritin sufficient mothers are much more likely to be iron sufficient themselves and not likely to incur any of the growth or neurological development or febrile seizures that are associated with low iron levels at birth. And for the mother with iron sufficient stores, even the bleeding of birth and after birth can be less threatening to her because she has this built-in margin because she has sufficient iron stores in ferritin. So this also greatly reduces the likelihood of being recommended an iron infusion in pregnancy. And iron infusions, they're becoming more and more common. Just toss them out there. Practitioners and patients alike aren't thinking twice about just firing iron straight into the bloodstream via an infusion. So I would personally be very cautious when it comes to iron infusions in pregnancy, especially as there really is a lack of demonstrated improvements in clinical outcomes with iron infusions during pregnancy. And there is a significant increased potential for harm when bypassing the body's natural checks and balances when it comes to iron Iron is, as we know, it can be really problematic and it can be really helpful. And we don't want it too high and we don't want it too low. We want it right there in the optimal range. So the Journal of Obstetrics and Gynecology noted that one birth can leave a fingerprint on the iron status for years down the road. Even in a menopause, you could see, okay, this woman had a baby, this woman didn't, this woman had 4 babies, this one had 1. And this doesn't need to scare you, but it sure should make you want to get your levels checked and make sure that you are refurbishing your iron stores so that you're not underperforming, for years to come. Thinking, like I hear often, this is just a side effect of motherhood. This is just mom life. It may not be mom life. It may be iron deficiency life. All right, I'm Dr. Matt. Hope this is helpful. Please like and share with anyone that you may know that is iron deficient, trying to overcome iron deficiency so that they can be empowered to know what to do about it. All right, talk to you guys later.